No one wants to think about their parents getting old. No one wants to think about their parents coming to the end of their lives. No one wants to think about getting one of those calls in the middle of the night and learning that your dad has just been admitted to the hospital. No one. Not even elder care professionals. But this is a story about real life and a real death. And it's told to us by two of AgingParents.com's founding partners. Meet Carolyn Rosenblatt, a nurse and an attorney. And meet Dr. Nicole Davis, a psychologist specializing in helping families deal with the challenges of caring for aging loved ones. The story starts in the tranquil setting of a Hawaiian vacation, interrupted by a phone call to Dr. Davis about his father.
Carolyn and I were on vacation. We actually were on vacation in Hawaii. My sister was informing me that the next step was to have Dad hospitalized and that I probably needed to fly back from Hawaii. So we flew back to my parents in Southern California with my father getting up in his 80s. I think that what went through my mind was, this is what my worst nightmare. This is the call that I never wanted to get. I was hours and hours and hours away. I was across the ocean. I was so far distant, I couldn't just jump on a plane and be where my dad was in an hour or two, and was worried that, my father might die before I got to the hospital. I was fortunate that Carolyn was with me at the time, but we were trying to interpret through my sister, who was an emotional mess, what were the medical facts that were going on so that we could better understand the level of emergency that actually did exist.
His father was 89. He had been feeling poorly for a few months. Being a nurse, some of the telltale signs were there that made me feel intuitively that he might have cancer and that they hadn't found it yet. And when his sister told him that they thought it might be pancreatic cancer, the worst fears that I had for him were also realized. Nicole was really trying to calm his sister and remain in control of his emotions at the same time. When we saw his dad face to face, by this time they had in fact diagnosed the cancer. It was a matter of trying to support my husband because both his mother and his sister were leaning on him.
Now we're in the hospital, and we're in an area where both Carolyn and I have been writing about the challenges of dealing with healthcare system. Now we're in the throes of the healthcare system, and we're dealing with doctors that aren't talking to nurses, and nurses that aren't talking to doctors, and technicians who aren't talking to any of those. And we're dealing with nurses that are floaters, that are from different countries, that are there just on a temporary basis for their 2 or 3 months working in the hospital. And now we're thrown into the middle of this amazingly broken, fragmented healthcare system, trying to get answers about whether or not my father's tumor that they diagnosed, which was next to the pancreas, was operable or not. And after a week and a half of tests and lots of challenges in trying to get people to communicate with one another, we finally got the best answer we could, which is that the doctor that was treating my father believed that if we could find the right surgeon, that my father at 89 was healthy enough that he probably could undergo some kind of surgery.
You're a nurse. You're a psychologist. You're talking to other like professionals who supposedly have the facts in front of them, and yet you're telling me it took a week in order to get any clarity or communication that made sense. Were you having to yell at people? Were you having to wave threatening documents? Were you having to corral people in the hallway and say, listen up, I'm here, we've been here for a number of days, tell me what's going on?
We had to do all of that.
Yeah.
We actually had to do all of that. The thing that we found the most irritating is that the doctors would do their rounds at around 7:30 in the morning. And when they would do their rounds, then after they did their rounds, they'd write their orders. And their orders were frequently to do different kinds of tests. And then in order for the tests to happen, even if they were tests that were urgent, that then the tests had to be coordinated with the transportation in the hospital, which was the people that would move my father by wheelchair to whatever facility that would do the diagnostic tests. And that once the tests were done, then the report would have to happen from the diagnostician, and then it'd have to be read by the doctor. And what we found is that frequently tests would be ordered, and at the end of the day, I would have been asking every 15 minutes, when are they going to move my dad for the tests? And they would say the orders haven't been written by the doctor, so we can't do the tests until they are. Then when the orders were written, I would ask, okay, now the orders are written, how come the tests aren't being completed? Oh, we have to wait for transportation. And at one point, I put my father in a wheelchair and was ready to wheel him downstairs to the various places to get tested because I lost patience with the whole process. Then once the test was done, the doctors couldn't do anything until the diagnostician that did the test would have to do their report. And so meanwhile, my concern was, my father's going to die while we're waiting for someone to pass on the information, which we found from our experience, often the information doesn't get passed on. And furthermore, when any kind of treatment was ordered for my father, we also experienced that one nursing shift wouldn't communicate to the other nursing shift. So we would come in and they would be wanting to give my father certain medications, which they had discontinued the previous shift, but it hadn't been communicated. So it was just an amazing nightmare, and the good fortune for my father and the blessing for me in my life was I had a wife that was able to continue to be working 500 miles away, and I just stopped my practice. I stopped my business, I stopped seeing patients, and I just decided that I was just going to stay in the hospital. My father was so scared about what was going on and that they were going to make mistakes, which it was so clear that they were going to be making, that my dad needed an advocate. So I became my father's full-time advocate.
I'm imagining that your wife provided some counsel to you on the phone?
She certainly did.
Carolyn, tell me about some of the calls that you got from Nicole.
First of all, this was very frustrating for everyone. This was a hospital in Southern California, which shall remain nameless, which touts itself as one of the finest in the country.
Number 3 in the nation.
And this was the best and brightest people available to provide health care. It wasn't lack of good intention, it was lack of communication. It was the constant changeover of staff. It was the disconnect between one specialist and another. Remember, this was an 89-year-old man, and they wanted to be sure if they were contemplating surgery, which they were, that he could withstand the surgery. The surgery had a lot of risks, and I knew that there were a lot of risks. I also knew that there were a lot of things that could go wrong before such surgery might take place. And because he had been married to Nicole's mom for 62 years, there was a tremendous upheaval emotionally for both of them. He didn't want to die and leave her. She didn't want to lose her husband and companion of that length of time, and they loved each other very much. And the other sibling was distraught beyond words. It was a very hard time. As an in-law, one has to be careful. You can't push your way through it all, no matter whether you know things they don't know because of professional experience or not.
But you did know things.
I did know things.
And I imagine some of the things that you knew is that you weren't surprised about anything that was happening.
I wasn't, and I was a little surprised that they elected to do the surgery, but I understood why they made that choice. The alternative wasn't very good. His father had pancreatic cancer. The prognosis is not good. People who have surgery and survive it, if they don't get all of the cancer cells, don't have a good outcome. There was hope that they would be able to excise the tumor, take it out, and that he would be okay with some chemotherapy. But he underwent the surgery having passed all of the screening criteria, and I knew that just because he got through the surgery alive didn't mean that he would make it.
But in the distance between you and Nicole and the situation going in Southern California and you being in Northern California, what could you actually do?
It was very hard. I was flying back and forth. Sometimes I would be there for a few days and then come back. Somebody had to tend to the business of our own lives. So I could really be phone support for my husband mainly. I never spoke with my mother-in-law. I never spoke with my sister-in-law. Neither of them could take in any more information, especially information that might be contrary to what they wanted to believe.
Did you speak to any of the professionals in the hospital?
When I was present. And his father underwent the surgery and within 3 days had developed the complications that everyone didn't want him to have. And he began a very rapid downhill course from that point. I knew that the chances of a good outcome were very small. He was getting worse by the day. It was my job to support my husband and help him cope with this reality that everyone could see, but no one was articulating. One of the most important things I think that came out of this for me was terminology. We say no code or do not resuscitate. And every kind of healthcare directive, living will, 5 wishes, whatever you want to call it, has those words in it, that someone does not wish to be resuscitated. What it doesn't tell you is the nuance, that the medical community and the physicians in this particular hospital found a way around that by calling this a chemical code. So when his father's heart began to fail, rather than letting it simply do that and letting him reach the end of his life through natural means, they used medication to change the rhythm of his heart to keep him going. We questioned for what purpose, because it gave him more days of being in this comatose condition on a respirator with everything in his body failing. But now that his heart had been changed to a more stable place, at least that wasn't stopping at that time. So I think what a healthcare directive needs to say very specifically is not only do not resuscitate, and you check that box or circle that part of the form, but you need to add the words in, no chemical code. And I think that makes it even clearer that the physicians need to not use the means that they may not consider resuscitation.
And if you run into healthcare providers that are not being sensitive to your responsibility as the person who has been given the difficult choice to make decisions to not resuscitate, and you aren't getting the kind of feedback that you think that you ought to be getting back, what do you do? Who do you go? What's the next step up the chain of command to insist that your wishes for the person who is under the care are in fact honored?
I think it's
And how long do you wait?
I think it's important to find out information from the direct caregivers, and those are the nurses. In this instance, we had at least 4 or 5 different physician specialists who were involved. There was the surgeon, there was an internist, there was a kidney specialist, there was a pulmonary person. There were all these different doctors, each with their own special knowledge, and they were trying to work with one another in a distant way. But each of them was responsible for his or her own little piece of the picture. There is not necessarily always one physician in charge. All of them were in charge of something. But I think from one physician, it's very important to be quite direct and to say, I would like to know what you expect the outcome to be. I did ask that question of the surgeon at one point. And I said to him, I'm not sure what you expect the outcome to be, but I'd like to hear from you what you think are artificial means of keeping Joe alive. He couldn't get out of the room fast enough. This was a very uncomfortable area for him. Once there's enough information to know, then you have to ask another question. What do you think the outcome would be if you keep him going? And if you don't get a straight answer, I think you have to keep pushing until you do get a straight answer. The real straight answer was, he's not going to get any better. The best we could do would be hope to get him off the respirator, and it's not likely. And I think it's very hard to get that information because people don't want to tell you that. They don't want to upset you. They don't want to face it themselves that their treatment hasn't worked.
But that's the part that you have to push.
That's the part.
And I think the other thing that I saw was that without having an advocate, when you go in the hospital, what are your chances of really getting what you need? And it's clear to me that without an advocate, I think you're just rolling the dice about whether or not you're going to come out of the hospital with seeing how broken and fragmented the healthcare system is, and that you need an advocate that's involved every day and as much as possible. And I can remember, in fact, at one point where I slept in the hospital and I slept in the room with my father. He was scared, and they kept on wanting to come in and draw more blood, and they couldn't get the blood out. And there were a number of times I just needed to kick him out of the room and say, no, this is not going to happen right now. And so one of the things that I see that is just mandatory for anyone that goes in the hospital is that someone needs to be identified as being the advocate. And if you need to rotate and have people take that task, that's critical. And to just trust that the doctors know what they're doing, and that your family member is in a reputable hospital and they know what they're doing, and you don't need to get involved, is just being the fool. If you think that the outcome out of that is going to be that your loved one's going to walk out of that hospital alive. We need to break the process of our own denial and our own fears about our own mortality. And we've got to be willing to suck it up and basically start the dialogue with our aging parents. We're potentially going to be burdened to take in their honor and to talk about what their wishes are and what they want to do. And there needs to be talk among the siblings about the adult children about, how are we going to handle this before the shit hits the fan?
What do we tell our kids about us?
That was one of the first things that happened with us after this experience, because we have 2 grown children. And I said to my kids, I hope you understand that Dad and I don't want artificial means. I don't know what drugs will be available by the time we get to the point, if we ever get to the point, where we're in a hospital and someone is making decisions about what to give us. But if my heart stops, and I'm 89 years old, I want you to let it stop. If I have a surgery that doesn't work, and I'm declining, and my body systems are failing, and they tell you that, I want everyone to get out of the way. And I want you both kids to be very clear. Mom doesn't want to be fixed up, propped up, and kept for a day longer with anything artificial. I want you to just keep me comfortable. I want you to make sure that I have fluid in my veins. I want you to make sure that all of you can be there if we're in that situation, that that's possible. And I want everyone to get out of the way, because I'm not afraid of the end of the life cycle. And I don't want you to be afraid of it. That's what I told my kids.
Go.
When the time is right, I don't want any artificial means of sustaining my life. And I don't want them to do anything that's going to stop the process. And I think it's a difficult discussion. We're blessed that the burden that became something that I was the nightmare that I never wanted to have happen. I think the blessing that came out of that with my father's death was our ability to be forthright with our own children about this, and even more so, I think both of our passion, both from a professional point of view and from a humanistic point of view, wanting other people in the world to maybe learn from our lessons so that they don't have to replicate what we did and can learn from our experiences so that they can do it even better than we did it and can do it without the pain and suffering that we had to endure. And that's my wish that will come out of this.
Seems like a good place to stop.
Thank you.
There was an added burden somewhat to my role, other than seeing my father be in the hospital, a burden that I don't wish on anyone. My father, after some consideration, had elected to choose me as being the one on his healthcare directive, to be responsible that if my father his life needed to be sustained in with any artificial means. My father wanted it clear that it was his choice to not have his life sustained in any artificial way. And when we checked into the hospital, I thought I was being efficient in providing them with the signed healthcare directive, that they understood from day one that if that choice had to be made, that I would be the one that would be taking that responsibility. And I recall, in fact, saying to my grown children that never in my life had I ever interviewed to be God and to be in the position of acting as God. And I remember having this conversation that I initiated with the doctors and made it very clear to the doctors that I wanted them to be straight with me and I wanted to know. And something that I didn't know about, which I'd never had an experience with, was that the doctors were perpetuating what I later called the conspiracy of hope. They weren't being honest with me. They weren't telling me that it's clear that because your father's health has now changed pretty rapidly and declined, that there really is very little hope that he's ever going to be able to walk out of this hospital. And so, unfortunately, we spent days and hours agonizing, believing that there was still hope. And that was actually when Carolyn showed up and really was able to burst through this kind of hypnosis that had kind of overcome all of us, where we wanted to believe that the doctors were still holding out hope, so we should just continue to sit there hour after hour waiting, even though my dad then was in ICU, wanting to believe that the doctors aren't giving up on him, so we shouldn't give up on him, and we shouldn't take any affirmative action that would end his life at this point. And it was Carolyn showing up that I think changed it.
I got there after Nicole told me that his father had deteriorated to the point that he was on a respirator. And I could understand why they made the choice, because he was conscious, he was having trouble breathing. I thought that was a reasonable course of action. But I was there when he went through the healthcare directive and made sure that I understood, this is, a couple of years prior, what he really wanted. He really didn't want a code, that is to be resuscitated. He really didn't want to have his life sustained by artificial means. When the doctors would come in and say things like, well, we haven't given enough hope, we haven't given up hope. It's the 4th of July weekend. We're just going to go away for 4 days and we'll see how he's doing when we get back. It was at that point that I became angry, because I knew they weren't being honest about the fact that he wasn't going to keep surviving unless they kept putting things in his body to prop him up. It was clear to me, just as a nurse from a very basic vantage point, and it's been a long time since I've actively practiced nursing, but from a basic vantage point, I could see that he was failing. There was no turning back. Even if they were able to change some of the system-wide failures that were going on in his body, what the outcome would have been of that, if they kept him alive, wasn't going to be good.
So you got angry.
I was angry inside. I was angry at their dishonesty with themselves. Doctors are trained to save lives and to heal. I really understand that. But they're not very skilled at honoring someone's wish to let go of life-sustaining measures.
So how did your anger manifest itself in this situation?
I had to hold back. I had to not say anything in front of the family members who were most affected by this. I spoke with the nurses, and I said, in ICU, I said, I don't know if I have this wrong. It's been a long time since I've worked in a hospital, but it looks to me as if Joe is dying. Is that what's going on here, or do I have this wrong? And they nodded their assent, as if to say, of course, he's not getting better. Of course, the end of his life is coming. And I couldn't understand why no one was being straightforward. But it was clear when I walked into the ICU and I saw no fewer than 8 IV lines in this poor man, that artificial means were indeed being employed. And I waited until after a little time had passed and Nicole had digested, shall we say, some of the reality by looking at his father, that I took him aside individually and I said, look, your dad put this job on you, that you are the one, the agent on the healthcare directive. That means you're supposed to honor his wishes. By this time, of course, his father was sedated enough to be in a coma-like state. He couldn't speak for himself. I said, you have to speak for him, because if you don't speak for him, they could go on like this perhaps for weeks. And he cried and he thought about it and he struggled with this idea of playing God, and it was very painful, it was very emotional, and he slept on it. And he woke up the next morning and he said, you know, you're right. We have to stop them. That's what Dad wanted. They were about to poke and prod his dad with more things, more artificial means. Nicole wanted to get to the hospital in time to stop them from trying again. So he called, and he did interrupt them as they were about to begin yet another artificial procedure, which would not have done anything to prolong his life or give any greater hope. It would have simply provided them more information about his condition. And he did tell them that my dad doesn't want any more artificial means and I'd like you to stop. And I was very proud of him for being able to stand up.
In looking at my mother, 86 years old, who's in the process of watching her companion of 62 years of being married to my father, frightened, scared, overwhelmed, my sister just being an emotional mess, and looking at the both of them and realizing that I've got to make that decision my father asked me to do. This is the responsibility that he asked me to take. And I've got to choose the time and basically the day when my father will stop living. And that was an intense burden, and there were lots of crying. I was blessed that both my children were there and my wife was there, and that they were there to help me struggle with being able to decide when the time would be right to make that decision. And I was shocked when I told the doctors what I was going to do, that I didn't get any support, I didn't get any assistance, I didn't get this is the most humane way, in a palliative way, to try to help move your father to the other side, and here's the most humane way to be able to do it. I got no help whatsoever.
You mean the doctors didn't say to you, you're making a good decision here?
They didn't say you're making a good decision. They didn't say you're not making a good decision. What I got is that they were committed to continuing to do what they needed to do to keep my father alive, regardless of the responsibility that I had.
And once you said to them, stop, did they?
No, they didn't. They didn't. And what it took was, and I found that completely shocking, what it took was my talking with the ICU nurses who were monitoring my father, and my having dialogue with the ICU nurses, with my wife in attendance, and talking to the nurses about what is going to be the best way that we can make my father the most comfortable and start decreasing the drugs that they were using to sustain his life. And so it was with the help of the ICU nurses, who I believe really were the angels, that helped me figure out what was the best way to send my father off. It wasn't the doctors.
And so they did eventually stop all of these different medications gradually in a reasoned way. And over time, he simply was allowed to reach the end of his life cycle.
And when he finally did pass, that must have been a dramatic and a relief moment for you all.
It was. I mean, I'd never experienced dialing medications to watch someone's life end. I'd never seen what that was like. What I was told from the ICU nurses was that we chose to stop the medications that he was on, other than what Carolyn said, the respirator and the pain medications, at 3 o'clock in the afternoon. And everyone said, you know, you need to prepare your family within the next three hours. Your father's going to probably be gone. And, you know, my father, being the stubborn person that he was, wasn't ready to go. And in fact, his heart started to compensate when they pulled off a lot of the medications and got stronger. He didn't want to go. And so we started this at 3 o'clock in the afternoon. I figured, you know, everyone else is going to be put out of their misery by the end of the day. We've been doing this and sitting in ICU for days on end. This is the most humane thing to do for everyone in the family, including my father. And my father finally expired around 2 o'clock in the morning. It took that long before it finally happened.